Hello, ladies and gentlemen. My name is Grünerová Lippertová. I am a specialization in rehabilitation, especially neurorehabilitation. And today we will look together for the pediatrics rehabilitation. You know, rehabilitation is a restoration to original state. It is important for the people to come back to the social environment and to have the chance of participation in a social surroundings. It is everything what is coordinated and going from the early phase of the illness till to the social integration. It is very important, it is much more important that the individual can live in a social environment and participate, like only to have some possibility of moving. We have in rehabilitation some arts, some forms of rehabilitation. Today we will speak about medical rehabilitation, but we have also social rehabilitation, we have also pedagogical rehabilitation, occupational rehabilitation. And it is sometimes a process going through weeks, sometimes through months, and sometimes also for the whole life of the patient. We are working in a team. We have a rehabilitation team. It is an interdisciplinary team of experts. We are working on the goal, on one goal. This goal is not our goal, it is a goal of the patient. What shall be done? In pediatrics rehabilitation, it is sometimes difficult to have this goal from the patient's health, but we have parents, we can look what is the problem, what are the possibilities at home, is the children at school or at home, and what's the kind of surroundings the children have. In this rehabilitation team, we have physicians, nurses, physiotherapists, occupational therapists, psychologists, speech therapists, nutrition therapists, special teachers, social workers, and prosthetics technicians, and much more professions. It is really interdisciplinary work starting to improve the activities of daily living of the child, depending on the age. We start with pediatric rehabilitation in neurology. We have some congenital or gained brain problems, cerebral palsy, coordination disorders, myopathy, neuropathy. We have some brain injuries, we have some brain tumors, we have spinal cord lesions. We have a lot of different injuries of the central and peripheral nerve system. What is very good message in a pediatric rehabilitation is that the brain has in this time of life a very high neuroplasticity. We have some arts of plasticity, evolutionary, adaptive, reparative. And we have seen a lot of dynamic changes, especially after the birth, then decrease a little bit between the certain 6 years, and after 12 years age, we have more or less a level of adulthood. But also the young people, especially up to 18 years age, have a very good chance of plastic reorganization and reparation of the central nervous system. Then we have a lot of patients in rehabilitation, orthopedics, traumatology, rheumatology. We have congenital development defects. We have scoliosis, Morbus-Scheuermann. We have trauma problems. We have hypermobility or juvenile arthrosis. We have a lot of diagnoses. They need the rehabilitation process also in orthopedics and rheumatology. And then we have a lot of other diseases, internal diseases, cystic fibrosis, asthma, cardiologic problems. We have also children with oncological problems, with burns, and not at least with psychosomatic and psychiatric problems. In this you can see that pediatric rehabilitation had a bright spectrum of the diseases. Here is the specialization very important to make it in a good and efficient way. Now I want to show you some possibilities of prescription. I show you a physiotherapy voucher, where can make this prescription in an in-hospital inpatient rehabilitation. It is attending physician. At home, it is a general practitioner, or neurologist, orthopedist, or some other specialist, or rehabilitation doctor. He can prescribe all the time. And in Czech Republic, you can see this voucher you have to fill out, and we have some codes, some codes for different things what to do. If you want to prescribe kinesiology analysis or individual kinesiotherapy or soft tissue techniques, you can see this is the main groups of this therapy positions. Okay, now you can tell me what is an individual kinesiotherapy 1. What is the content of this? It is a Voiter reflex locomotion, for example, Bobat concept, quadrupedal locomotion, Brunkov concept, sensory motor therapy. And if we see what is individual kinesiotherapy 2, these are soft techniques, mobilization, stretching of muscles, strengthening, kinesiotaping. That's a different one. What is important in pediatric rehabilitation is the distribution of therapy according to the age of the children. Yes, we have also to do it always with regard to the diagnosis, especially. We have a period of 0 to 3 years. In this period, we have no active cooperation of the child. What can we use? We can use Voiter's reflex locomotion. We can use Bobat concept, soft techniques and handling, mobilization, stretching, kinesiotaping. These methods we can use in this very early phase of life. Then we go to 3 to 6 years. In this period, we can have a moderate cooperation, and we have also to focus the therapy in a fun form, exercise a little bit. We have some physio-ball exercises, also Bobat concept, club concept, walking pads, some inclusions in a group exercises. We can do much more in this phase. Up from 6 years up, we have active cooperation, that the child can be included in the exercises, in the therapy. And we can choose the techniques as for adult therapy. We adjust the complexity of the exercise according to the age of the child and the movement ability. Yes, all these concepts can be done in a very intensive way, because up to 6 years the child is going to school. It can be a really complex therapy possibility. Okay, what can I show you? I can show you perhaps something special from Czech Republic. It is, for example, Voiter's reflex locomotion. Professor Voiter developed this therapy concept in the 50s, 60s, 70s years of the 20th century. And he was working on a concept with treating children with cerebral palsy. It's this reflex locomotion is a therapeutic principle in which motor reactions, so-named coordination, that are initiated to each person are activated, triggered. Coordination complexes are triggered. What can we do, what can we see in the diagnostics based on Wolter's principle? We are looking at first for spontaneous motor skills. The child's movement patterns, expressions are evaluated in a spontaneous expression. We do it in different positions. In the supine position, in the prone position, turning on the stomach, sit, angled sit, climbing, standing and walking. We are looking for the spontaneous motor skills. Here is some picture of this different positions and what can be reached in which age of the child. It is in Czech language you can see on the top měsíců means month, and then on the left side vertically you can see the different positions then. Okay, and then we look for position reactions, and this dynamics of primitive reflexes is investigated in provoked movements. Abdominal sling, underarm hinge, verticalization, side hinge, horizontal, vertical hinge. Yes? More one, more two, panic reactions. Yes? There's a lot of different possibilities. And we are talking about global coordination complexes. It is a reflex scroll and a reflex turn. Yes? And in this therapy, the parents becomes the therapist. It's important. The physiotherapist show and teach the parents the therapy in such a way that they can perform it well at home. It is why it is necessary for the dose and frequency of therapy. It must take place 4 times a day. And during this therapy, the central nervous system is stimulated and activated. Yes? And then the child can be able to use these movements also in a spontaneous movement. And this frequency is very important. It is a lot of time the parents spend with this therapy of their child. And the therapist is looking for teaching and for supervision of the therapy. We can stimulate some movements by press of some triggered zones. You can see here some examples of triggered zones for the reflex turn of the child or for reflex scroll of the child. The main principles in the therapy are to use the correctly adjusted position of the child, lying on the back, on the stomach, on all fours. And this position is always chosen with regard to the age of the child. And these triggered zones, what I will show you in the pictures, we are activating these triggered zones by pressure to activate the reflex locomotion. It is a principle of the therapy. Okay, let us change from Wolter to Bobat. Bobat therapy was developed by Berta Bobat. He was a physiotherapist from Germany, and her husband, Karel Bobat, was from Czechoslovakia. He was a neurologist, and they were working together in UK, and they developed this concept and founded the Bobat Center in London. Yes, in this also a neurodevelopmental therapy, This is just using round about the word, not only for treating of children with cerebral palsy, but also other neurological diseases, especially post-stroke patients, brain injury patients. This concept developed and is using all the time also for adult patients, not only for children. The basis of this concept or the method is the recognition of muscle tension, yes, and the determination of the change of the tension. The alteration muscle tension can be hypotonic, reduced, or can be hypertonic in form of spasticity. And this alterated tension of the muscles leads to incorrect movement. And the children repeats the incorrect movement, and in the repetition is a fixation of it. It is a bad possibility to learn a bad incorrect movement. And this is very important to adjust the muscle tension, and it leads to correct movement and to learn the correct movement for the child. We are in this concept also speaking about handling. What is the handling? The handling leads to optimization of the pathological muscle tone, in the most cases spasticity, and then the children can move easily and correctly, so easily and correctly as possible. And this handling is also used by parents, and this handling contains the normal daily activities. The parents learn from a therapist how to handle the child, how to carry it, how to feed it, how to dress it, in which positions and situations to play. And it is a good form, a good possibility to learn healthy, correct movements for the child in different situations of a daily living. Sometimes in Bobat concept we are talking about 24 hours management. It means that everybody who is handling something with a child knows this concept and works on this concept, and also all the surroundings of the child will be adapted for the improvement of the function of the child. Okay, let us go to quadrupedal locomotion of Klapp. It is a German concept developed for treating idiopathic scoliosis. It was orthopedics, Bernhard Klapp and his son, Rudolf, surgeon, and they were seeing that they have a big interest for scoliosis and for the treatment of scoliosis by children, and they saw that the climbing at all fours, the spine is exposed to a mobilizing, stretching, strengthening, and corrective influence at once. That means the climbing on fours is very, very protective for the treatment of scoliosis. It is also a therapy based of developmental kinesiology. Ideally, if this movement is good performed, the root joints, shoulders and hip, are centered, and thus the correct static and dynamic load for these joints. Okay, I can show you some pictures here that you can see in which kind of exercises Klapp therapy are involved. Then I show you also a little bit about kinesiotaping in children. It is a supportive therapy, a little bit facilization, a little bit posture correction, It can be supportive used by different movement disorders. And at last, sensory motor therapy often used by children. It is a sensomotor stimulation. We have various balance exercises performed in various starting positions. We use the activation, this balance exercise we use for the activation of proprioception, means deep sensitivity. And we have some aids to do it. We have some balance sandals, balls, mini trampolines, and so on. We try to make these exercises with the children to improve even the postural stability and balance. Okay, it was from my side. It was a short introduction to pediatric rehabilitation. I hope it was a little bit interesting for you. In my opinion, I want to show you some practice exercises. We have possibility of video presentation from Docent Grünerová in pediatric rehabilitation of MUDr concept, and I hope it will be a good practice possibility to see it. Thank you very much for your attention, and goodbye for today.